person and all the judges. I'm here to present my paper on the association of kidney and eye disease, which has been correlated to an iceberg. To begin, as we all know, there's a common soil hypothesis that the human eye and kidneys share similar structural, developmental, genetic pathways, especially with respect to the vascular networks, filtration barrier, and the RAS hormonal cascade. The even the vasculopathies like diabetes and hypertension also uh, affect both the systems similarly, if not equally. The ocular manifestation could be the result of the primary nephropathy disease or the secondary effect of the renal failure or the complication of the treatment modalities to manage the CKD. The nephropathy and retinopathy usually go undetected until the disease is well advanced. There have been previous studies linking the two systems, most significant of which was the retinopathy in chronic renal insufficiency cohort study, which determined that the eGFR of less than 30 ml per minute per body unit body surface area was associated with 3 times higher risk of retinopathy than in patients with normal GFR. Even PDR and maculopathy could cause 5 times more blindness in diabetes with glomerulopathy than in normal subjects. Even hypertensive retinopathy is particularly more severe in severe renal failure. Retinopathies are usually typically asymptomatic in the most treatable stage and thus cause a delay in the diagnosis and significant visual impairment. 400 patients of diabetic CKD without any pre-existing ocular disease were undertaken for this study and analyzed for any ocular signs, and any correlationship between the diabetic retinopathy and nephropathy was observed. It was observed that most of the patients in the study were males in the 4 to 6 decade, presenting late in the with advanced and stage renal disease. Most of the patients were asymptomatic, mostly had only symptom of blurring of vision, and more than 50% of the patients had never undergone any ophthalmical examination, which indicates the lack of awareness among the patients. Most of the patients had diabetic retinopathy, cataract, and maculopathy as the reason for their visual impairment. Diabetic cases of CKD were mostly presented with severe NPDR. Um, Both non-proliferative and proliferative diabetic retinopathy were more common in the advanced stages of nephropathy. Even hypertensive CKD cases had more severe grade 3 and grade 4 hypertensive retinopathy among the maculopathy patients. DME and ARMD were the most common findings. Of the 400 eyes examined, as close to 74% patient eyes had some anterior segment pathology. 80, as high as 87% had posterior segment pathology, whereas 67% had both the segment involvement. Only just 2.5% of the CKD patients had no abnormal ocular signs. As can be seen with this figure, the more severe and more higher grades of diabetic retinopathy were more commonly aggregated with in the more advanced stages of nephropathy. Similar was the skewing seen with hypertensive retinopathy and maculopathy seen here. To discuss this was the first comprehensive analysis of the ocular manifestation in hypertensive and diabetic CKD and the association of nephropathy with the severity of the retinopathy involving the team of ophthalmologists and nephrologists in the eastern India. We found a substantial evidence of close association between the kidney and eye disease, retinal microvascular changes like the reduction of nephropathy. CKD in turn was associated with more risk of diabetic hypertensive retinopathy, cataract, and maculopathy. Both hypertensive retinopathy and diabetic retinopathy, be it NPDR or PDR, were more frequent and present in more severity in the progressive stages of nephropathy, with showing a very positive, significant correlational relationship. To conclude, in India, where there are more than 70 million diabetics and a substantial percentage of these cases would be progressively developing diabetic nephropathy and diabetic retinopathy, ocular examination is essentially warranted at regular intervals to prevent visual impairment. However, there are still no standard clinical guidelines for routine eye screening in nephropathy patients. There's a substantial need to screen these nephropathy cases to find out any associated ocular manifestations, however asymptomatic, to reduce the morbidity and disease burden of the CKD, as we can conclusively say that hypertensive and diabetic CKD cases are mostly detected in the advanced stages only when they are symptomatic ophthalmically.
Sorry,
That's the tip
sorry
of
to
an
interrupt,
iceberg.
sir. Please, I'll request you to please conclude.
You please, yeah, please stick to
Thank you.
time.
I finished my question. Thank you.
Okay. Any questions?
Only one thing I wanted to ask was that very nice study, very good conclusion, but majority are diabetes and blood pressure related. Did you find any nephropathy besides these two diseases causing the eye problems correlation?
Yes, sir. We did. We also found causes of an analgesic nephropathies, or we had only few exclusion criteria regarding the nephropathy, as in any case of nephrotic or nephritic syndrome, or any cause where there is pre-existingly confounding disease which might affect both the ocular and the renal system were excluded. Other than that, many other causes, drug-induced analgesic nephropathy were quite common. Even infection-related nephropathies were also common.
Okay.